Well, here we are. Meet my new friend. It's about the only friend you have during COVID-19 restriction phase. Tomorrow the restrictions start in the Melbourne metropolitan region and Morningside and the Hume area. Look, I haven't done a COVID-19 update for a month or two, so I thought I'd do an update because of the deteriorating situation in the Melbourne metropolitan region. So I think it's important that people understand what's actually happening, because it affects each and every one of us, whether we live in Melbourne, whether we live outside of Melbourne in regional Victoria, whether we live in Australia or whether we live in any other part of the globe. Because the thing about a pandemic, and the word is pandemic, is it goes everywhere. And the great thing about COVID-19, if there is anything great about it, is it doesn't discriminate. Obviously, it has a more profound impact on people who are living in crowded situations, who are faced with poverty, who are faced with the problem of earning a living when there's a lockdown. Obviously has a more profound impact on that part of the community, but it does not discriminate. It doesn't care what language you speak, what the colour of your skin is, what your culture is, whether you're a Trump supporter or not a Trump supporter. If you don't do the right thing, you get infected, and that's one thing that the Americans are learning very quickly. Now, why is it important? Now, if you don't live in the Melbourne metropolitan region, Mornington Peninsula, or the Hume Council area, you may think this is all a bit of a joke. Well, it's not a joke, and it's not a joke for one very good reason. Now, COVID-19 is part of the corona family. It is a relatively new virus which has crossed from the animal family to the human family. And although a lot of people say it originated in China, recent research has shown that it's been around in the sewage system of many countries for a few months before it actually turned up in China. And as I've said on my program, The Anarchist World This Week, for a number of years, the major issue we face with climate change isn't the slow increasing in temperature, which obviously is having an impact, but it's the change of the ecology of the planet. Because the thing about planet Earth is it is an isolated sphere with a little atmosphere around it. And what happens in one corner of the planet has a profound impact in another corner of the planet. And recent research, which was put out by Oxford University in the last few days, highlights the fact that we should be concentrated on the ecology of the virus, and that changes in environmental factors, changes in temperature, climate change, can have a profound impact on the type of virus and its spread. For example, in 2008, we saw the beginning of the SARS epidemic, but it seemed to have died down relatively quickly, and some people think it's due to a change in environmental factors. Now, whether it's environmental factors, whether it's the fact that the Victorian government's outsourcing program of outsourcing security to private organisations in their save a penny to spend a pound campaign as far as the isolation hotels is concerned, caused the new spike in infections in the Melbourne metropolitan region. I think the important thing we need to remember is, irrespective of how it's caused, whether it's the ecology, environmental change, whether it's droplet-borne infection, whether it's due to the outsourcing policies of the Victorian government with security, the issue is that it's here. So why is it important? Now, in the United States of America, which I'll do a comparison with, the mortality rate from COVID-19 is about 4.7%. That means about 1 in about 22 people who have the infection die, and that's a relatively high incidence. In Australia, the mortality rate is about 1%, so about 1 in 100 people who get the infection die. Now, we all know that it's people who are elderly, people who have got comorbidities, which is a fancy word for saying they've got a lot of medical issues, are the people who are the main victims. And we all know that we have a national health system, we have a pharmaceutical benefit system, we have a free public health system, and in regards to many other places in the world, we have an extremely good record in actually dealing with the infection once it comes to hospital, as long as we have enough intensive care beds available. And the mortality rate should remain at about 1 in 100. So why is this an issue? If the mortality rate is only 1%, why do we close down the environment? Why do we close down business? Why do we close down the city? Why do we social distance? Why do we think of our neighbours as our enemies? And the list goes on and on. If its mortality rate is only 1%, how is it different to influenza? I'm sure that the mortality rate from influenza last year was much higher than the mortality rate from COVID-19 at the minute. Well, the equation is very simple, and this is where we need to look at the situation and actually concentrate, all right? Now, as far as influenza is concerned, we have some herd immunity, we have vaccination against influenza, the various viruses which form the influenza family, and we also have certain treatments which have some impact on the influenza. Now, COVID-19 is a new virus. It is something we have not been exposed to. And I'll give you an analogy. When the West conquered the rest of the world, whether it was the Americas or Australia, its main strides that were made in conquering and dispossessing indigenous people was through disease. Whether vertically or inadvertently, it was through disease. It was through the introduction of diseases the local population had no immunity to. Things like measles, typhus, smallpox. There are records at Port Jackson and Sydney Cove, short periods after the colonisation began in 1770. There are records of hundreds, if not thousands, of indigenous people dead on the beach. Not because they'd been shot or poisoned, but through disease. Because these populations had no immunity to the diseases which the Western world brought here, to which we had some immunity, because as a people we'd been exposed to them for hundreds, if not thousands of years. It's the same story with COVID-19. This is a new virus. There is no vaccine. I'll repeat that again. There is no vaccine for COVID-19. Irrespective of what you hear, currently there is no vaccine, and there may not be a vaccine for some time, although we've got the best brains in the world working. There was never a vaccine developed for SARS. If a vaccine had been developed, we would have been able to contain the COVID-19 issue. So there is no vaccine. That's one. Two, there is no recognised treatment to deal with COVID-19. There may be on the periphery some treatments which you can use in intensive care, which may have an impact on survival rates, and we've seen increased survival rates in the United States of America as more and more people are turning their attention to the question of not a cure, but a question of using medications which are available to actually decrease major symptomatology, things like dexamethasone. So there is no vaccine, there is no cure, and most importantly of all, there is no immunity. There is no herd immunity in the community. It's not as if we've been exposed to this for decades, if not hundreds of years. It is new. Our immune system cannot, in the majority of, cannot in some cases protect us. It does offer partial protection in many cases, but it does not offer protection for people with reduced immune response. People who are elderly, people who've got multiple illnesses. And you've got to remember that the thing about Western medicine is that many people who are alive today would have been dead 50 to 100 years ago, because of the type of medications and public health actions we've taken. So there's a huge proportion of the population, about 20%, who are at great risk from COVID-19. And even among younger people with comorbidities, there are a great risk. So let's do some figures, and this is what I think will actually highlight how important social distancing is. Let's do some figures. Let's say Melbourne has a population of around 5 million people. Let's say 5,000 people get COVID-19. We've already got about 1,000 new cases. Let's say 5,000 people. 10% of 5,000 is 500. 1% is 50. So you'd expect 50 people to die. Let's say we have 50,000 people with COVID-19, and the way it spreads, it's very likely we may reach that number here in metropolitan Melbourne. 10% of 50,000 is 5,000. 1%, 500. Let's say we have 500,000 people with COVID-19, that's 1 in 10. Let's say we didn't do any social distancing, the restaurants kept working, everything was normal, right? And it'd be quite easy, within 2 or 3 weeks, we would have 500,000 people with COVID-19. 500,000 people, 10% is 50,000, 1% is 5,000. Once you get to those type of numbers, we've only got 6,000 intensive care beds in the whole of Australia, about 2,000 at the most in Victoria. So what you can see is once the hospitals are swamped and people need intensive care beds, we will see increasing numbers of people who will not be able to avail themselves of ventilators who will die. So the mortality rate will increase, say from 1% to 4%. So let's go back to that. Let's say 500,000. Let's reiterate these figures, because it's quite possible that in 2 to 3 weeks we would have 500,000 infections. That's 1 in 10 people in the city of Melbourne, greater metropolitan region of Melbourne, having coronavirus, right? 10% is 50,000, 1% is 5,000. That means 5,000 people would die in the space of a few weeks. The issue is not just the 5,000 people who have died, but the issue is the fact that the hospital services would be swamped and there would not be enough ventilators, irrespective of the help from the other states, in order to put everybody who needed a ventilator on a ventilator. So the mortality rate would then increase from about 1% to about 4% in the figures which we are seeing in the United States of America. So you'd go from having 5,000 people dying to 20,000 people dying within the space of a few weeks. So you can understand how important social distancing, washing your hands, using a face mask in certain situations how important it becomes, and how important it becomes in communities that can't social distance. And if there's one thing this has highlighted, this whole COVID-19 pandemic has highlighted, is the abysmal state of public housing in this country, especially in Victoria, which has pursued a policy of privatising public housing, which has refused to spend money to update facilities in these housing estate, which even now is refusing to provide the basic necessities. And when you add outsourcing to the situation, we see the schmozzle that we are currently seeing in Victoria when we've only got less than 1,000 active cases. A total schmozzle, because everything is outsourced. Governments do not have the facilities via which to provide services. The reason we find ourselves in this situation is in metropolitan Melbourne is the fact the security company which won the contract to provide security for the people who are returning from overseas, from the hotels which they were quarantined in Victoria, did not adequately train its people, did not adequately provide resources, and I spoke about that before. But on top of that, the same security company was providing security in the estates in Flemington, Kensington, before the COVID-19 explosion. And if you've been into these estates, and I've been into them as a doctor and to see friends, everybody goes in through one door, everybody passes security before you get to the lifts, and if the lifts are working, you're lucky. So you can see how easy it is for the infection to spread. Although people would like to social distance, would like to wash their hands, would like to do all the right things. So it is a particularly difficult situation, and the reality is that if we don't take the necessary social distancing precautions and wash our hands, we may find ourselves in a situation where there are 20,000 people who die in the space of 2 or 3 weeks because the intensive care units are overrun if only 10% of the population has COVID-19. Now, irrespective of whose fault it is for the situation in Victoria currently, and I'm pointing the finger at the state government's spend a penny to save a pound approach to security, irrespective, we have to deal with the situation. We have to make those decisions. So I'm encouraging you not to be depressed about this. We can all get involved. We can all help to contain the spread of the virus. We can go about our lives the best way we can. But one thing I'd like to say is that we need changes. We need radical change. We need reform in this country. And if one thing that the Eden-Monaro by-election highlighted to me, it's the importance of being a registered political party. If public interest before corporate interest had been a registered political party, we could have put in a candidate in Eden-Monaro and actually brought forward new discussions about a universal basic income so we don't find ourselves in this disaster, discussions about the need for extensive public housing reform, discussions about the change in the taxation system, discussions about nationalising our resources and using our resources for the people's benefits, not the benefits of private individuals. So I'm encouraging you, even imploring you, to look at the possibility of joining public interest before corporate interests. It's very simple. Go to our website, pipsy.net. Have a look at the application form. Download it, fill it in, post it to me, send it to me. You can email it back, we will get it. If you're not computer literate, if you're not interested in computers and you want to learn about public interest before corporate interest, leave a message on 0439 395 489, 0439 395 489, or you can write to me at Post Office Box 20, Parkville 3052. That's Post Office Box 20, Parkville 3052. Remember, the ball's in your court. It can be business as usual, more privatisation, more deregulation, more globalisation, more corporatisation, more outsourcing, more inadequate responses to the COVID-19 pandemic, or you can make a difference. If you don't want to join public interest before corporate interest, get involved in activity, because change comes from people's active participation in the struggle to change the status quo. With an increase in militarisation of police forces across the country, especially the Victorian Police, with the deployment of the armed forces around the country during the COVID-19 crisis, with the fact that there is no individual protection from the arbitrary exercise of state power, it's at the state level or federal level, it's time that we, as a people, took matters in our own hands and got involved in the struggle for reform and radical change.